Now we will discuss about etiological factors of class 1 malocclusion. Number 1 is skeletal factor, soft tissue, dental factors, which include space arch discrepancy, that is crowding, and spacing. Early loss of permanent molar, displaced teeth, vertical discrepancy like open bite and deep bite, transverse discrepancy, for example, cross bite, and bimaxillary dental alveolar protrusion. The last one is trauma. These are all the factors that lead to class 1 malocclusion. Now we will talk about the clinical features of each of these factors. First of all, we'll talk about the skeletal factor, which may be associated. The clinical feature we can see in skeletal factor is mild transverse discrepancies like vertical skeletal proportions, vertical discrepancy like open bite, deep bite, and transverse discrepancy like cross bite. Now we'll talk about soft tissue factor. Soft tissue is favorable and is not an etiological factor. The major exception to this is bimaxillary proclination, where the upper and lower incisors are proclined. This may be racial in origin, but can also occur because of lip tonicity, which results in incisors being molded forwards under tongue pressure and has implication for planning retention. Now we'll talk about dental factors, and the clinical feature we can see is crowding and spacing, and is a main etiological factor in class 1 malocclusion. Talk about crowding. Crowding occurs where there is a discrepancy between the size of the teeth, that is, when there is increased tooth material, and the size of the arches, when the arch size is increased or decreased, resulting in crowding. So there is loss of permanent or deciduous tooth, will result in the remaining teeth tilting or drifting into the space created. The elective extraction of the teeth is one method of alleviating crowding in a crowded arch. Now we will talk about late lower incisor crowding, and it is most noticeable during the mid to late teens, in which there is forward growth of the mandible, soft tissue maturational changes, and the third molar pressure. Next we talk about spacing, which is a clinical feature of dental crowding, dental factor leading to crowding. This spacing, we will talk about generalized spacing and localized spacing. Generalized spacing is rare and is usually due to either hypodontia or small teeth in well-developed arches. Localized spacing may be due to hypodontia, traumatic loss of tooth, or because extraction was indicated due to displacement, morphology, or pathology. Median diastema. Median diastema is a type of spacing. A median diastema is a space between the central incisors, which is more common in the upper arch. A diastema is normal physiological stage in the early mixed dentition. Placed teeth, another etiological factor of class 1 malocclusion, and it is due to abnormal position of tooth germ. Canines and second premolars are the most commonly affected. Lack of space for a permanent tooth to erupt within the arch. Those teeth that erupt last in a segment, for example, upper lateral incisors, upper canines, second premolars, and third molars, are most commonly affected. Prolonged retention of a deciduous procedure leading to crowding because of the retention of the deciduous teeth. Secondary to the presence of a supernumerary tooth or teeth. Look at the picture. The arrow is indicating to the supernumerary teeth, conical shaped, between the central incisor and leading to crowding. Secondary to pathology, for example, a dentature cyst. And displaced teeth may be also caused by a habit like thumb sucking. Now we'll talk about vertical discrepancy. The features we can see in vertical discrepancy are, number 1 is anterior open bite, and you can see the other one is deep bites. Vertical discrepancy can occur in association with any anterior-posterior skeletal relationship like class 1, class 2, and class 3. Transverse discrepancy is the same, can also occur in class 1, class 2, and class 3 in malocclusions. And vertical transverse discrepancy is between the arches, and it is resulting in crossbite. Look at the purple arrow showing the posterior crossbite. Now we will talk about bimaxillary dental alveolar protrusion, which is also an etiological factor of the class 1 malocclusion. And it is occlusion where both upper and lower incisors are proclined. It is more commonly seen in racial groups, for example, Afro-Caribbean. When bimaxillary proclination occurs in class 1 malocclusion, overjet is increased because of the angulation of incisors. And you can see for treatment, we'll talk about the high courage requirement is needed, but there are chances of relapse. You can see incompetent lips, anterior open bite, and a decreased interincisal angle. For understanding of increased decreased interincisal angle, we will make a video on cephalometric analysis. As I have already talked about treatment of bimaxillary dentoalveolar protrusion, the chances of relapse are more. Thank you for watching this video. So